Hi, I'm Kristen Camella, and I'm a stem cell scientist. I've been working in the field since the late 90s and have worked with a variety of different types of stem cells, and our goals have always been to combat different degenerative diseases. I've worked with bone marrow stem cells, fat-derived stem cells, cord blood-derived stem cells, and to date, our favorite for using for patients has been fat-derived stem cells. I've recently been ranked as one of the top stem cell scientists in the world, number 24 according to Terrapin's Top 50, and number 1 according to the Academy of Regenerative Practices. We can harness stem cells from one location in our body and place them to a new location in our body. The main purpose of stem cells inside our tissue is to repair any damage that has occurred. By harnessing those cells from one location and putting them where we want them, we can now repair specific tissues that may have been damaged because of disease. Stem cells are hard at work inside our body all the time. In fact, if you didn't have stem cells, you could only live for about an hour. Regardless of your age, you've got stem cells hard at work in your body. And now we can take those stem cells and put them exactly where we want them and combat different diseases that are associated with the aging process. There are a variety of different types of stem cells. One is embryonic stem cells. These are obtained prior to a baby being born. You can obtain the cells which can be utilized for different indications. However, embryonic stem cells have not been used for most diseases for patients at this point. It is still in the research phase. And there is potential risk associated with using embryonic stem cells. These cells tend to grow very rapidly, and they have the ability to become many different types of tissue, and so are often considered similar to wildfire in that they can rapidly go down different pathways. Adult stem cells, which are the ones that we are utilizing, can be obtained from the patient themselves. These cells are committed to forming only certain types of tissue and are much more appropriate for utilizing for specific diseases because they can only form a subset of tissues. Two of the most common sources of adult stem cells are bone marrow or fat tissue. Bone marrow has been around slightly longer and was pioneered in the 60s, whereas fat tissue is a newer source that has been considered for harnessing stem cells. It turns out that fat tissue is one of the most plentiful sources of stem cells inside our body. We can get about 500 times more stem cells from fat tissue than from bone marrow. The other benefit to using the stem cells from the fat is that the number of white blood cells is much lower coming from fat tissue than from bone marrow. This is important because white blood cells create inflammation. And when we're trying to harness cells to combat different diseases or injuries, we want less inflammation. Therefore, fat tissue is the preferred source for stem cells.
Hi, I'm Dr. Eric Edgerton, and I'm here today with my partner, Dr. Vincent DiPasquale. We're a clinic founders and owners of NSI Stem Cell. I want to introduce to you a diabetic patient of ours, Brian. Brian came into our office not some time ago, and actually it was his idea that we're here today, so he can share his kind of story with you, but more importantly, answer some questions that we have for him. So Brian, thank you for being here today. We appreciate that. Just real quick, I have a question for you. What brought you into NSI Stem Cell, and what were you hoping to accomplish coming into the clinic?
Well, when you're almost dead because of diabetes, and you just don't have any energy whatsoever, you are always looking for something that's going to be life and life-changing. My doctors was not giving me that. They were saying, well, we'll just keep giving you pills. And I said, well, will I ever get off of it? No, you'll die with it, and all this stuff. And I said, that's not the right answer. So I was on Facebook and seeing your all's little ad. So I went in, seen you. And when I went in, I didn't know what to expect because everybody was telling me, oh, no, you better stay away from that. My doctor was telling me that, they didn't want me to come.
What were they telling you to stay away from?
The stem cell.
The stem cell.
Yeah.
Yep.
but what I learned was they don't know anything about it, so that's why they told me to stay away.
Correct.
But when I came, my expectations were to be lively again. I was in bed almost 22 hours out of the day, had no energy, in pain constantly, and didn't want to do anything, just nothing. And I have a daughter that lived with us, and she wanted to go do stuff. Dad, come, let's go do this. Not today, baby. I can't do it. And then when I walked someplace, I had a cane or a walker constantly. Wow. And so my expectation was to get to a better place than what I was at. Right. And to live the dreams that I had that I had to put on hold or just even forget about, because they were telling me, well, you can't do this and you can't do that ever again, ever again, ever again. So I had just put up in my mind I couldn't do it anymore. Right. So, but you gave me hope when I came in, and that was what I wanted to have done, was just get in and have some life come back in.
Yeah, I appreciate that. I think you speak for a lot of diabetics out there nowadays. Did you previously know anything about stem cell prior to coming into NSI?
Not really. I heard, they were taking them from babies, and they were this and they were that, and, all the stuff that people are afraid of that just didn't really even get in to check on it. They would go on what somebody said, and that's all they did. And that's what they were trying to fill my head with was, hey, you don't need to be doing that. And so, I was apprehensive when I came in, but I knew by just talking with you that, you explained everything right down to the T. And from their version and your version, it was two totally different things. So, I wanted to get in on something that was going to, really be good. So I quit listening to all the naysayers and just started plugging in. So
wonderful.
So essentially you sought out information and made some decisions for yourself.
Yes, I did. Yes.
After having the procedure, are you happy with your overall experience in our office internally, and then with the results that you experienced so far?
Yes. My results back up. When we were talking about the procedure, you said, no, it's not going to happen overnight. It's going to take a week or two or whatever. And I said, okay, I've went 3-5 years, whatever, like this. So, a couple of weeks ain't going to matter. But like I told you, the day of the procedure, my left leg had been numb for almost 2 years. And that was with back surgeries. And I've had 6 back surgeries too. So that was not doing anything to relieve me with the pain. So the thing was that I really didn't feel any different until they said to get down, on the floor. And when I got down on the floor, I felt the floor underneath my left foot for the first time. And that was exactly right after they got done doing the procedure, which I was waiting for a week or two down the road for all this stuff to start happening. And it wasn't. It was happening like right now. So, and I know everybody's body's different, so you're going to have different times, right. But with mine, it was just a booster for me because I wanted this to happen. I wanted it to be really well. And it started right there on the spot when I hit the floor. And it's been doing good ever since.
Can you tell me a little bit, elaborate more on your results that you had over the last 2 months?
I think as it relates to the specific condition of diabetes and then possibly some of the other issues you were dealing with, like you said, with the numbness in your legs, lots of diabetics have neuropathies. And I think that's one of the deciding factors to seek treatment is pain.
That was it. And with it being in my toes and feet, you walk on them. That's the thing. And then my thing was I had that pain, plus I had the back pain going from a sciatic nerve all the way down to my feet too. So I had 2 pains that I was trying to battle. And doing this procedure, it has taken all of that away. And the thing with the diabetes is too, you have to watch what you eat, and then you still don't really get the results you want. You go on this diet, and then they tell you to go on that diet. So you're doing all these different things. That's not really helping. But with the procedure, and then Dr. Eric sitting down and saying, well, we need to work on this, and this, like your food intake, this, nose, all of that stuff. It took me to a different place. It took me to a place of revelation where, okay, this can be done. I got to put my mind to it. I got to stay focused. And the wellness part is the thing that I am really so happy about, because my doctor was saying there's no hope. But when I came in, that was all turned around. And after the procedure, it's been that way the whole time.
What's your sugar levels now? Would you say?
They've been running about 130, and they were like 300 and 500 before I came into the thing. And it's been it's been really great because I'm feeling better. I don't have that. I don't know how to explain it. It's like you're in a lost time zone somewhere when your sugar's like up there high. Sure. And it was to the point where sometimes I couldn't get out of bed because I would feel like I was just going to fall out or whatever. And that's not the case anymore. It's, and I had wedding cake and all that stuff, and the sugar only went up to like 135, 140. So, I mean, it would have went up to like 600 beforehand. So, see, I'm seeing results that way, which is making me feel really good about the decision I made to have this done. So.
Thank you for sharing that. And if you had to say anything to any diabetic patient that may be watching this video about getting stem cell procedure done in hope for reversing their diabetes, what would you say to them? And maybe speaking to the camera when you
get it done. The thing that I was looking for was I didn't want the answer that the doctor was giving me. He kept giving me no hope, and he would say, I said, well, what if my sugar goes up? Well, we'll just give you another pill. His answer was another pill. I don't want another pill. I don't want a Band-Aid to cover it. I want a solution. And I think that's the way a lot of my friends are back home. I've got people now, they weigh like 300-400 pounds and their sugar is like sky high. And they said, well, I don't know if I can afford it. I said, well, you take a look at this. I said, by the time you look at if you have to go in the hospital and stay, even 2 or 3 days, that's $30,000-$40,000. I said, then your medication, some of it pays, some of it doesn't. You've got all these expenses. And I said, if you go and get this done, you will be so happy because you'll be able to do stuff with your kids, your grandkids that you have never been able to do for a long time. And that's the way I am right now. I'm doing things. I played volleyball for the first time 4 weeks ago in almost 3 years. I haven't been able to do anything, haven't been able to jump, haven't been able to run, haven't been able to do anything. But now I'm doing that. I'm getting on a kickball team. I'm doing bowling. I'm running. I'm doing a lot of things that, quote, my doctor said I could never do again. So I'm thankful that I did this, and I really would urge you to really check things out and just go in and get all the information you can. Just don't listen to people, because people's going to try to guide you one way, and it's not the way you want to go. If you want to be healthy, you want to be right, and you want to be whole, you need to have something done. And this is what it is, because from what I was to what I am now, it's been totally total makeover.
I just want to say I appreciate you coming today, and I thank you for sharing this for all the diabetic patients that could be watching this. I appreciate it.
Thank you.
Thanks a lot.
Appreciate it.
Hi, I'm Dr. Vincent DePasquale with NSI Stem Cell. I'm here with my partner, Dr. Eric Edgerton, and we have our patient, Richard, who is a diabetic patient who we've treated with stem cell. And what I'd like to do is just ask him a few questions, share his story. This way you guys out there can hear it, okay? Richard, thanks for coming, bud. So what caused you to reach out to us, NSI Stem Cell, and what were you hoping to accomplish initially?
My main problem, besides my diabetes, was neuropathy in my legs, and it was just getting worse and worse, and to the point where I didn't have any equilibrium. And I had to be careful about falling over, which I did several times. And Terry heard about NSI and talked me into going down there, and here we are.
She dragged you into the office, didn't she?
Pretty much the first time.
And then Terry's your daughter, correct?
Terry is my daughter, right?
So did you previously know anything about stem cell therapy prior to coming in?
I had heard very little about it. I knew it was kind of an up-and-coming thing, but I didn't really know too much about it.
What was the deciding factor to move forward with us in terms of receiving treatment?
Well, after I spoke to you the first time, you pretty much told me that the diabetes wouldn't even be a problem, and that you thought the neuropathy would be a big improvement. I stopped. I did not by the doctor's word. I just did it myself, and I stopped all my. At first, I stopped just the diabetes meds, metformin, and I was taking 2 a day, 850 milligrams, and my glucose readings were coming down in the 90s. So I said, I'm going to knock off one of the pills. So I was only taking 1 a day. And the readings went up a little bit. They were coming in around between 100 and 110. And I said, I'm going to knock off the second one. So I knocked off the second one, and the readings now, like today, the reading was 104 this morning. And they've been running pretty much between 104 and maybe 120.
Yeah.
Every
And I
day,
think that's
every
important.
day.
I think that's important. We don't just get off meds unless, our laboratory analysis or our daily readings are consistent with coming off meds, right?
Yeah.
So you're doing better as a result of the treatment.
Oh,
That's why we
definitely.
can take less medication.
And then the printout that you gave me on my last blood work, I showed it to the doctor, to my regular physician. And he checked it, and he went, oh, my God. He started asking Terry all about your place. And so you'll probably be hearing from him, because I think he's a diabetic himself.
That's awesome. Yeah.
What were you, don't mind me asking, what was your sugar levels prior to getting the procedure done with medication?
Well, to be honest with you, I didn't take a reading that often.
What was your blood work, your A1C or anything, do you know?
My A1C was up around 7, probably between 7 and 8
With medication? With the medication?
with the medication.
Okay.
Yeah,
Okay.
and lost my train of
It's
thought.
wonderful.
It's all good. It's all good. So after having your procedure, obviously you're happy with the overall experience. Tell us a little bit about what you can do more as a result of feeling better, because I know that you're moving quite a bit more and a lot better. So tell us a little bit about that.
Well, the nurse there at your place, Gina, I think her name is, told me to start exercising, because I was telling her how my legs, were. I had trouble going upstairs, just trying to lift my own weight up, And speaking of weight, I ended up losing 30 pounds. The first day I walked into your office, I was 225, and for the first time in probably 25 years, I'm under 200. So I'm down to 195 now.
You look
Which
great, by the way.
I hadn't seen it in a while. Hadn't seen the 190s in a long time. And but I started walking. My house is set back off the road like 300 feet, and I would drive the golf cart down to get my newspaper, which would be thrown on the ground by the road. And when Gina talked to me that day, I says, okay, I can start walking and exercising. So now I walk down to get my newspaper every day, and walk around the yard. And we got a big area there. We got 4 acres, 4.5 acres, and so I got a lot of land to walk around.
That's good. That's good. So
Wonderful.
did you find the procedure to be difficult at all? And would you recommend us to other individuals?
Well, we've already recommended you to several people, and no, I didn't find it hard at all. I don't want to call it a diet, but that body
Program.
cleansing, whatever it's called, in the
Wellness
beginning,
program, yeah.
that was a little tough to get started on, just the first day or two, because some of that stuff was kind of gross. But once I got into
It's a
it,
big change, right?
and I figured out how to get rid of that aftertaste in my mouth, And then it was okay, and I went right through, and I stuck to it. I stuck to that diet,
You did a great job.
Yeah.
I surprised myself actually that I didn't cheat on it,
Yeah.
Because it's not a diet.
It's
Because
not
you're
a
gaining
diet.
health. So
Right.
It's about
Yep.
the difference. between
And I could
actually
see
not
my
eating.
weight just like melting off of me every day, and I'm like, Jesus Christ, it's working, And now, I think I'm 2 weeks short of 3 months, and you were saying the other day that it takes about 3 months for the stem cells to kick in.
Yeah.
So I'm kind of waiting and hoping that I get a little more feeling in my legs. And,
Yeah. And we have that to look
hope
forward
them
to, which is great.
nerve endings can heal up or whatever they do.
Yeah. Absolutely. Well, Richard, thank you for coming. We really appreciate it. I mean, our goal with today's conversation is really to help other individuals know a little bit about what we do and that there is hope and that there is help for these types of conditions. So we really appreciate it.
Okay.
I'm glad you're doing well.
Appreciate it.
Thanks for doing all the work.
My name is Susan Kearns, and I came to NSI because I was excited that they actually had something to offer me for my diabetes besides medicine. And I just couldn't believe that there would be something that would help me. And so they explained the stem cell transplant to me, and I decided that that was the way I wanted to go. I was tired all the time. I had no energy. I had a horrible diet. I wasn't hungry most of the time, and I made myself eat stuff that I didn't really even want, and just because something inside me was telling me it was time to eat. So I had numbness in my feet, my legs. I was having problems with falling. My doctor actually had talked to me about getting some other treatment, and I took some Tai Chi classes, which didn't do anything to help me. But I realized I couldn't feel the bottom of my feet anymore, and that was probably what was hindering me. Since I've had the treatment, I'm in week 5, and I'm about 5.5 weeks into it now, and I feel marvelous. I mean, every morning I get up and I just can't believe that my blood sugar is somewhere between 95 and 110. And it just amazes me that I can eat so much food and not be hungry and have my blood sugar stay normal. I'm down to about 1/4 of the insulin I used to take and about half of my long-term insulin that I used to take at night. I feel wonderful. Everybody tells me I look wonderful. My friends tell me I'm walking with a little bit of a hop in my step now, which is really nice. I just feel great, and I would recommend this for anyone. I've been a diabetic since I was 22 years old, and I was so tired of life at 68. I'll be 69 in a month, and I can't believe that I feel this good now. This is how I always hoped I would feel when I got to be an old lady. So this is me as an old lady. So if you think this will help you, then go ahead and do it. It's wonderful.
My name is Richard Engel, and approximately 7 weeks ago I started this process with stem cell research. And since then, through the diet program that I'm on and through the instructions that I've received, I have lost a total of 23 pounds. But better yet, my insulin intake has went from 156 units a day down to 40 units a day. My health is so much better, my attitude is better, I feel so much better overall just from listening to the instructions given to me by this office. So if anybody's even thinking about what this is going to entail for them to start doing it, you need to get off your butts and do it. It will work. I promise you, you will feel much better about yourself.
Hi, I'm Dr. Vincent DePasquale with NSI Stem Cell. A common question I'm asked is, how long will my stem cell results last? Since stem cell therapy taps into your body's own healing ability, the results can be long-lasting and permanent. Initial improvements can be evident within the first few weeks and continue through the healing process. According to some published studies, stem cells will continue to repair tissue and patients will continue to show improvements for well up to a year after the procedure is performed. So what that means is the tissue that is repaired and regenerated over the period of 12 months is yours and permanent. Hi, I'm Dr. Vincent DePasquale with NSI Stem Cell. A common question I'm asked is, what kind of results can I expect with a stem cell procedure? The most recent study that we have that has been published has shown a 93% of patients respond to the stem cell therapy with positive results, such as reduced pain and regeneration of healthy tissue in the damaged areas. So most can expect fantastic results.
Hi, I'm Dr. Eric Edgerton with NSI Stem Cell. Common question I'm asked is, are there any side effects of stem cell therapy? Side effects are typically minimal and include minor pain and irritation at the incision site. Since we are using the patient's own stem cells, chances of immune system rejection are virtually zero.
Hi, Dr. Vincent DePasquale from NSI Stem Cell, and I think it's important to understand what makes us different as it relates to stem cell therapy and what we do in our clinics. We are a functional medicine integrative healthcare practice first. We use stem cell therapy as one of the tools to essentially meet the needs of our patients, and what that means is that we take an individual's health into account first and apply many different interventions to improve health. That's the key. You know, when we're dealing with an orthopedic application for stem cell, let's say it's a knee osteoarthritis patient, I always tell patients, you know, it's not that I don't care about their pain or I care about their knees, it's that I care about their ability to achieve health. And we need the ability to move and ambulate in order to achieve health, and those are always our goals. When it comes to complex metabolic disorders, things like diabetes and autoimmune conditions, applying just stem cell therapy, yes, can be very beneficial in affecting those conditions. But I think if we don't deal with the complex metabolic issues that are present, I think it's really an allopathic paradigm. I think it's a short-term fix and not a long-term solution. So we need to do the things that are necessary to treat you as a whole, whether it's diet and lifestyle modification, biomechanical disadvantages that may have caused some of the pain patterns. All of those things are taken into account at our clinic, and I think that's what makes us special.